Welcome to another edition of A New Me. Our guest experts help you learn about the latest medical advances and procedures by providing you with the real information necessary to help you eliminate the dangers of making the wrong medical and cosmetic enhancement decisions. Get ready for your consultation. Coming up, we will be on location in Towson, Maryland, discussing the benefits of dental implants and how they can help restore your dental health and give you the smile you've always desired with one of this area's top oral surgeons, Dr. John Emmett. Dr. Emmett received his dental degree from the University of Maryland Dental School and completed his surgical training at Georgetown University Medical Center. Dr. Emmett is a diplomat of the American Board of Oral and Maxillofacial Surgery, and he is the only Baltimore area oral surgeon who is a diplomat of the National Dental Board of Anesthesiology. Dr. Emmett is also a fellow of the American Association of Oral and Maxillofacial Surgeons. Welcome, Dr. Emmett.
Well, thank you for having me on.
Oh, it's our pleasure. Your first time, in fact, on our program. We've got a lot to talk about. I understand there are 3 patients that are going to be joining us a bit later in the program.
Indeed, some of the larger implant cases that I've done.
Yes, and I wanted to begin, by asking you if you can please tell us what dental implants are for those of us who may not know.
Well, dental implants are titanium fixtures, almost screws, if you will, and they are placed into the alveolar bone, which is the bone that houses the teeth when we're missing teeth, to help anchor a future tooth or possibly a denture.
And what types of problems do they correct, Dr. Abbott?
Well, they correct a myriad of problems, actually. If a person unfortunately has to lose a tooth, a dental implant can be used as a single restorative treatment where the patient can have an implant placed and have a tooth placed on that implant. Or you could have a completely edentulous patient who would come in and they might have no teeth and be tired of wearing a complete denture. In that case, we can either restore the entire dentition with fixed prosthetics, which in other words, we would place implants throughout the upper jaw and the lower jaw and build crown and bridge work on those implants that they would no longer have teeth that would come out of their mouth. Or if they were simply tired of their complete dentures being loose, we can place a few dental implants to sort of lock those dentures down. Now, they would still be removable, but they would get a lot more anchorage with the dental implants.
Very interesting.
Yes.
So there's a lot of flexibility and range there.
There is so much flexibility with dental implantology. It's amazing and growing every day.
Now, Dr. Emmett, who would you say is a good candidate for the dental implants?
Well, I think anybody is really a good candidate. We've learned with the literature currently that dental implants are being used in more and more patients who in the past that we really haven't used them in. But there's been a lot of current literature even with people that have diabetes and smokers, and we're gaining knowledge that they are working better with research and technology and the betterment of implant processing. We're learning that they're even working in those types of patients as well.
And for the viewers out there who are interested and realize they could benefit from something like dental implants, what would you tell them the typical process is or would be? I know it varies, I'm sure, based on the person's individual problems and how much work is going to be needed, but generally speaking, what's the process that a patient would go through?
Well, that's a very interesting question, and indeed, the process can be anywhere from 2 months to an entire year, depending on how much preparation the jaw may need. Now, if the jaw is atrophic or small, okay, because it's resorbed away over the years that the person has not had teeth, okay, we may have to rebuild the jawbone with bone grafting prior to doing the implants. On the other hand, if a person comes in and unfortunately loses a tooth, we take the tooth out, we allow the area to heal. Okay. That typically is about 2 months. We come back and we place the dental implant. Now, the dental implant has to go through a phase known as osseointegration, which is basically fusing to the bone. In the upper jaw, we typically will give the implant roughly 3 to 4 months to osseointegrate. In the lower jaw, we can usually get the implant osseointegrated in about 2 months. At which time, then they go back to their restorative dentist or their prosthodontist and have the prosthesis made.
That's certainly good to know. So as you just basically explained, it varies based on each
does.
particular patient.
It does indeed. And typically for me, they'll come in, they'll have a checkup before the implant is placed, after the extraction. We'll take an x-ray, we'll say they're ready to go. Then they have the implant placed, one follow-up, and then I leave them alone for whether 2 months or 4 months and bring them back for a final x-ray at the end before they go get their tooth made.
Now, I wanted to ask you, Dr. Emmett, how long does it take to actually place the implant when they come in for that particular appointment?
Excellent question.
Is it a lunchtime thing or
amazingly,
more work?
Amazingly, to place a single tooth implant, it usually takes me about 15 minutes.
That's it?
That's it. That's
Wow.
it. And painless and
And quick? Yes.
Very fast. I will tell you that invariably, people that have come to me to have a dental implant placed, i.e., or let's say to have a tooth out and then have a implant placed, invariably everybody says the extraction of the tooth is much worse than placement of the implant. It's relatively a painless procedure. Analgesic medication like Tylenol or Advil is all they need.
That's it.
That's it.
We're now going to meet some patients of Dr. Emmett. Welcome, Julia.
It's nice to be here.
Oh, it's our pleasure to have you on with us. We always appreciate it when patients in their very busy lives take some time and come down for a few minutes to share their experience with us. And on that note, I wanted to begin, Julia, if I may, by asking you if you can please tell us what dental problem or problems you were experiencing prior to coming to Dr. Emmett.
I've had a great deal of dental work done because I had an accident when I was a little kid and had just gotten permanent teeth. And so I've had several bridges done, and they tend to come out over time. And I'd had years of that because I was about 9.
Oh, my goodness.
So I'd had years of work done, and so this was a nice permanent solution.
And I take it that these problems had affected your life quite a bit?
Yeah, I remember being a young teenager on the bus, and a friend of mine turned around to talk to me and hit me with their elbow. And it wasn't even a hard hit, but it didn't take much. The bridge that I had was what they call a Maryland bridge that is attached from the back, and it knocked out, so I had my front teeth in my hands, and we got over it, but it was a really tough time to think, well, what do I do for the next few days to get some teeth in my mouth, because I have school tomorrow, and it's really humbling to be a teenager with those front teeth when they are not dependable.
It's already hard enough being a teenager without that.
That's
you
right.
add that to it, oh my God.
That's right.
You're absolutely right. So then I take it you came to Dr. Emmett, and what took place? What happened?
Well, I had many bridges over the years, and a lot of people have had them. Growing up with it, the teeth that support it will wear out.
Okay.
So then other teeth need to be used to be the supports for that, which means you're kind of losing teeth as you go and get older. And being so young, I'd been through several, and of course that means sometimes they're coming out, sometimes they're just loose. It makes it hard to do anything, to talk clearly, to eat. So I came to Dr. Emmett knowing that it was necessary now to have the implants done. And I had several implants to support several teeth, and it was nice to then not have to worry about them.
Yes,
being
absolutely. So you've been coming to Dr. Emmett then for many years, I would take it.
Yes, actually, for many years.
And he's been your dentist to take care of all your needs.
That's right. He was the doctor who could take care of the long-term structural implants, and then dental work is done by a dentist after that.
Sure. Well, he's obviously one of the best oral surgeons in the area.
That's
so
right.
he's done a great job with you. I
That's
take it
right.
you're very pleased with the results.
I am, and I actually have known so many people who would then ask me, where do I get implants, or how does it work, or how much do they cost? And when I spoke with people, they were all surprised because if they had looked into it at all, it was less expensive. And of course, I have confidence because Dr. Emmett's done so many.
Yes.
We've known him personally for so many years. And my family, there's so many people who've had a few here or there. So we've had a lot of experience with it, and it's been all good.
Well, we're very happy to hear that. And I take it your quality of life is at a high right now. You're very pleased.
Yeah, we are really pleased because it's now a permanent solution instead of wondering or worrying about, whether I'll have some trouble with something or how long this one will last before something needs to be done differently.
That's right, absolutely. And lastly, Julie, I wanted to ask you, for all the viewers out there that are watching, what would you tell them about your experience over all these many years with both Dr. Emmett and his staff?
I think they were perfectly capable, very comforting as you go through something that's new to you. The procedures are pretty quick. Mine was very involved, so that's unusual. But I just felt like they were very efficient, and I trusted completely that they knew what was best. They could also tell me what was coming, so I would say, oh, I recognize that this is the next thing, and just really felt they were competent.
Well, I'm very happy to hear that. And on that note, I'd like to thank you, Julia, for coming down and sharing some of your experience with us.
Sure, thank you.
Our pleasure. Great to have you with us as well today, Mike. How are you?
Great, glad to be here.
Oh, it's our pleasure. I wanted to begin with you, like I did with Julia, by asking you if you could please tell us what dental problems were you experiencing prior to coming to Dr. Emmett?
Well, the reason I came to see Dr. Emmett is I had some old crowns that were disintegrating. They were fairly old, and it looked like the teeth were cracked. And my alternative was to have gaps or to fill in the gaps.
Oh, so they were definitely affecting your life and your bite and everything else.
Well, I wouldn't want to go outside with big gaps
That's
in
right.
my mouth. I wouldn't have that perfect smile that I'd like to have.
Yes. So then what happened? You came to Dr. Emmett.
Well, Dr. Emmett took a look, and of course, first teeth that were disintegrating had to be pulled, had to be extracted, and that was kind of sad. But you know, Dr. Emmett is a weightlifter, and he's a very powerful man, and it was extremely fast, extremely quick, and I was very happy and satisfied, and I knew I went to the right person. And he told me about the dental implants and what that entailed, and that sounded like a perfect solution to my problem.
And it's a permanent solution as well,
Absolutely.
as opposed to a temporary stopgap,
Yes.
like some other treatment options out there.
Right. Plus, there's some good things about having implants. They're not sensitive to cold
Yes.
or the usual problems that you have with teeth, and they are absolutely permanent.
And I'm very happy to hear that. And I take it this all took what, within a few months or so from start to finish?
About 3 months for
Okay.
his total work, and then I went to my regular dentist to take care of the crowns.
Okay.
And that took just a few weeks.
I take it you're very pleased with the results.
Absolutely. I came to the right person.
And for the viewers out there that are watching, what would you tell them about Dr. Emmett and his staff and your experience here?
They're extremely professional. I had confidence in what they were doing. Every question that I had a great answer, and I'm satisfied with the results.
And you're going to continue to come to Dr. Emmett if and when in the future you ever need any treatment.
I'm under treatment right now.
Oh, there you go. Well, Mike, on that note, I'd like to thank you as well for joining us and being a guest on our program.
Thank you very much.
It's our pleasure. It's great to have you with us today as well, Jerry. Thank you for coming down.
Thank you. It's good to be here.
Oh, it's our pleasure. Now, I wanted to ask you as well, as I asked the other patients, Jerry, if you can please tell us what dental problems you were experiencing prior to coming to Dr. Emmett.
I had several root canals. And one of the root canals had gotten very old, and it was going to have to be done again. And so my general dentist suggested that perhaps I would like to try an implant.
Oh.
So I came to Dr. Emmett, and we talked about the procedure, how long an implant would last, and I decided that was what I needed. And for better or for worse, I have had a number of them since I got started. And part of my problem also is that my teeth need to last a long time.
Yes.
My mother is 99 years old.
Good for her. God bless her.
So my teeth have to last a long time. And so I have gone on and had, I think, 6 implants.
And I think the great benefit of this treatment among many is that these are permanent results. You're not looking at
Yes.
a temporary solution here.
That's
And
exactly right.
especially with long life running in your family.
Exactly.
You want to have that, you want to be able to chew and have your regular function, right?
Right.
Now, how long did the treatment take in your case? As far as you started with 1 implant, I know you've subsequently added others.
Right. I've had 6 over the last 11 years.
Okay, so you've had them incrementally put in
Yes.
over time.
Never more than 1 at a time.
Okay, got you. Very good. And what would you tell the viewers out there as far as your experience goes with Dr. Emmett and his wonderful staff here?
Oh, they have just been grand. They are so supportive. They take such good care of you on the day that you have all the work done and every time you come back for a checkup. And Dr. Emmett likes to see his patients every year just to be sure everything is all right, look at the x-rays and make sure that everything is still all right. And I really appreciate that.
And I take it again to finish up here that you're very pleased with the results.
Oh, very pleased. And undoubtedly, I will have to have another few before it's all over with.
Well, hopefully many more years for you as well, like your mom, Jerry. And on that note, I'd like to thank you for joining us and being a guest as well in our program.
My pleasure.
Our pleasure. We're now back with Dr. Emmett. I must say, all three of the patients speak, they just nothing but compliments, loving their experience here with not only you, but the wonderful staff that you have here, Doctor.
Well, thank you very much. The three that I have chosen are larger implant cases. I mean, they're interesting in that Miss Summers, she had a number of dental implants, if I recall correctly, which were all done at the same time to restore her upper jaw. With fixed prosthetics. And Mr. Ketsis, if I recall, he's been an ongoing process over probably the last 10 years. Unfortunately, he loses a tooth, comes in, has an implant, and a year later he'll lose a tooth and come back and have an implant placed.
Yes.
So he's an ongoing process. So that's the type of people that I meet in the Towson area. Lovely people.
Well, you certainly improved their lives. They
Well, thank you.
feel literally like a new person in many cases.
Thank you very much. Thank you.
Now, what type of results? Obviously, the patients here that we're on, and we just talked about, great results. Is this typical of what people could be looking at when it comes to the dental implant treatment option?
I mean, amazingly enough, dental implantology is a very predictable science. I will tell a patient when they ask, risks and complications, what is the prognosis of this procedure, and I, state strictly from the literature that says, 96 to 98% of dental implants are successful.
That's a huge success
It's a
rate.
huge success rate. It really is, comparatively speaking to the old crown and bridge work that
Yes.
I refer to as antiquated dentistry these days.
Absolutely. Now, I wanted to ask you, as far as the results being permanent, is that what we're looking at here?
Yeah,
Pretty much.
that's a great question, and we can say the results are as permanent as we have been using dental implants. I will say that dental implantology has been used with the public since the mid-1970s. So I guess that's 35 to 40 years, something like that. I personally have been doing implants for 22 yees, 23 years.
Very well experienced.
Yeah,
indeed.
yeah, I've put a few implants in, that's
Yeah.
for sure. In fact, I have a number of implants on my mother-in-law that I did in my residency that are still that are still working. Thank
Wow,
gosh.
that's great.
But people say, how long do they last? And all we tell them is, as long as they maintain good home care and oral hygiene, they hopefully will last forever.
Certainly very good to know, Dr. Emmett. Now, I understand there's some patient before and after pictures that you'd like to show us?
Well, to outline a case which involves a lot of different treatment, I've selected Miss Alunen's. We just completed her implants last week, but we had a lot of surgery to do prior to getting to that point. So she presented to me about a year ago, actually, with advanced periodontal disease, and all of her posterior teeth on the right and the left side, and her anterior teeth were hopelessly involved with bone loss associated with periodontitis. So we went ahead and we removed all of the teeth except her eye teeth, which are her canine teeth. At the same time, I'd like to also point out on the Panorex that she had a very low sinus cavity. In other words, her maxillary sinuses were so pneumonized or enlarged that we couldn't initially get dental implants in, so we had to plan bone grafting after the extractions were performed. So this is Miss Alunen's. Now that we've taken her maxillary right posterior, her maxillary anterior teeth, and her maxillary left posterior teeth out because of the periodontitis. And you can see no longer does she have the large pneumonized sinuses that you saw before. We've added bone into the sinus cavity, which will now be allowed to consolidate, get hard, and then we can place dental implants. So this is, after her initial surgery, what she was left with. She was left with, again, just the eye teeth. And the prosthetics that we use is a temporary removable partial denture. Now, could you imagine living the rest of your life with something like this? That would be just horrible. What we see here are the eye teeth that we left that were relatively stable, and she's got a removable denture that has posterior teeth, anterior teeth, and posterior teeth on the left as well. But this is a prosthesis that comes out at nighttime. So, in the end, last week we had our bone graft was nicely consolidated, and we went ahead and we placed her 6 dental implants. Now, on these dental implants, we will be doing fixed prosthetics. Fixed prosthetics, in other words, are teeth which are not removed at the end of the day. They will be fixed crowns and bridges. We'll have a 3-unit bridge made here. We'll have a 3-unit bridge made here, and we'll have a 4-unit bridge, which will give her her anterior incisors back. And this portion of the restoration will be performed by her general dentist.
I think that gives us a really vivid example of what we're talking about.
Well, I think it does. I think it does. I like to use this example because it shows all the different procedures that we can perform as oral and maxillofacial surgeons to prepare a patient to have a lifetime of successful teeth.
That's right.
It took a long time. It took a year to the point that we got to do her dental implants. And she still has some more time.
Yeah.
As I say, we put the implants in last week. She probably has another 3 months before she can get the implants loaded with her fixed prosthetics. But on the other hand, if someone loses a tooth, we let it heal for a couple months, put the implant
That's
in,
it.
put the tooth on in 2 months.
Yeah,
So
it
it can
depends.
be short, it can be long, depending on the complexity of the case.
Yes, and that was one of the more complex ones, I would think.
Indeed it was.
We're now going to watch Dr. Emmett perform a dental implant procedure. We're now back with Dr. Emmett. That tells us exactly what's involved in this particular case with the one implant that you just did.
Yes, it was relatively unremarkable procedure. Kind of get in and get out type.
Yes. What are we looking at as far as follow-up visits are concerned after the implant or implants have been placed?
Typically, the protocol for follow-up for dental implants is I will see the patient normally about 10 days to 2 weeks post-operatively, allow the gums to heal, allow the sutures to come out on their own. I'll get the patient back to make sure that there are no problems. And at that point, we will just let them know to keep the area clean, and that we'll see them in either 3 months if it were a maxillary or an upper jaw dental implant, or 2 months if it were a mandibular implant. At which point they come back for their final follow-up, where I take an x-ray to just make sure that the implant is integrated into the bone before I send them off to their general dentist or their prosthodontist. Now, that in addition to, I like, and I don't know if every oral and maxillofacial surgeon does, but I bring my patients back once a year to take x-rays just to make sure that there's no problems with the implant, make sure that their home care and their oral hygiene is good, and I will normally do that for 3 to 5 years after the dental implant is placed. Okay? Patients seem to like the closeness that we provide at our practice, and it gives me an opportunity to reiterate how I'd like them to take care of my dental implants.
Yes, and speaking of that, that brings me to my last question of this very enlightening interview, and that is, you and your practice certainly have developed a reputation of excellence in the field of implant dentistry as well as patient care in this region, and I wanted to ask you, Dr. Emmett, what would you say separates you and your practice apart from many of the others?
I think honestly, I think that's an easy answer. Quite frankly, I bring empathy to my patients, and a lot of what I hear in the community, a lot of the oral surgeons are, I'm not saying they're not empathetic, but they don't take their time with patients, and they don't sit and listen to a patient's questions, a patient's problems. And when you sit down with someone and really listen to them and listen to their chief complaint and their overall goals, it makes them feel good. And then you be empathetic throughout the entire process. I think that means a world to most people. And also the other thing is keep your fees reasonable. You know, keep your fees reasonable. I know a lot of people out in the community that are charging a lot of money for dental implants, a lot more than they should be charging. So we keep our fees relatively reasonable, and you be empathetic with patients, and they'll tell their friends.
We've certainly heard that from the 3 patients that we interviewed today, and others through our research that we found that you all really care about your patients. You customize specific solutions based on their individual respective needs. There's no cookie cutter approach taken here
Not to any patient
at all.
Not at
and
all.
it's, if anything, it's the way it should be, quite frankly, and the way it used to be years ago,
Well,
more
thank you.
commonly. And it's kind of gone the way of the dodo a bit, except practices like yourself confirming that there are practices in this specialty that really care, that really go the extra mile for their patients. And on that note, I would like to thank you, Dr. Emmett. This has been a very educational interview, from the patients to the procedure footage to the pictures, not to mention this very informative Q&A with you. I want to thank you again for joining us and being a guest on our program.
It's really been my pleasure to have the experience with you. Thank you.
Thank you, and we'd love to have you interviewed again in the future.
And we'll make sure that happens.
Thank you.